Myth versus reality. It is a battle as old as time, a conflict that rages not just in stories but within our very own minds and bodies. The myth is that a simple sugar pill can do absolutely nothing. The reality is far more complex. The mind can alter how we feel and generate measurable physiological changes based on belief alone. This is the heart of the placebo effect. It challenges our understanding of medicine, healing the connection between mind and matter. Have you ever wondered if the relief you felt was from the medicine or from the simple act of taking it? Welcome to the Study Freak channel, your destination for exploring the science behind intriguing questions. If you like deep dives into facts and the mechanics of human experience, like this video, subscribe, share with others who are curious. Today we begin a journey into the world of placebo effects. At its core, a placebo is any substance or procedure that appears to be a real medical treatment but has no active therapeutic ingredient. Think of it as a stand-in, a prop on the stage of medicine that looks and feels like the main actor but has no lines to deliver. It can manifest as a pill made of pure sugar, an injection filled with simple saline solution, a sophisticated-looking device that is secretly turned off. Its purpose in science is to serve as a benchmark in clinical research, allowing scientists to rigorously test new medications and therapies. The true magic is not in the placebo itself but in the reaction it elicits. The placebo effect. It's the measurable, observable, or felt improvement not due to a drug or invasive treatment. Example: someone takes what they believe is a powerful painkiller, their headache subsides even though the pill was just cornstarch. That is the placebo effect. The world of placebos is surprisingly diverse, with different types designed to mimic medical interventions. Most common type: sugar pill, tablet, or capsule inert substance, sucrose, lactose. Classic placebo in drug trials: painkillers, antidepressants. Simplicities: its strength replicates taking oral medication, isolates psychological component. Patients see a pill, swallow it. Expectation of relief. No active pharmaceutical ingredient enters the system. Another prevalent type: saline shot injection of sterile, salt water. No medicinal properties used where treatments are injections. Vaccines, biologic drugs. The ritual can amplify expectation. Most dramatic: sham surgery, used in strict research settings. Finally, fake devices appear therapeutic but inactive. The workings of the placebo effect are not just a trick of the mind, they are a real neurobiological event rooted in the brain's complex chemistry. The process begins with expectation conditioning. When you anticipate that a treatment will make you feel better, your brain begins to prepare for that change. This expectation is a powerful cognitive function that can directly influence your perception of symptoms. Your brain essentially says, "Relief is coming," and starts to act as if it has already arrived. This is why the ritual of a doctor's visit, the appearance of a pill, can be so potent. Cues that trigger this anticipatory response. This expectation then translates into tangible chemical changes. A placebo can trigger the brain to release its own natural painkillers. Endogenous opioids, endorphins. Patients given a placebo they believed was a strong analgesic showed brain production of these opioids, which then bind to the same receptors that drugs like morphine would. Brain scans show pain modulation areas activate, dampening signals before conscious awareness. Beyond pain relief, placebos tap reward and motivation systems, primarily via dopamine, demonstrating the brain's predictive capabilities. The scientific literature is filled with compelling studies that demonstrate the undeniable reality of the placebo effect. One of the most famous areas of research is in pain relief. In a seminal study, individuals with post-operative pain were divided into groups. Many in the placebo group reported significant pain reduction, nearly rivaling the actual drug. Then, some responders were given a drug that blocks opioids. Their pain immediately returned, proving relief came from the brain's own natural painkillers. Another powerful example: Parkinson's disease. Patients believed they received a groundbreaking treatment. In reality, they underwent a sham surgery. A year later, scans showed increased dopamine production. Patients reported better motor function and quality of life. Conditioning studies show a sweet drink paired with an immunosuppressant can later suppress immunity on taste alone, demonstrating a learned automatic response, much like Pavlov's dogs. The placebo effect is a fascinating phenomenon, but its role in medicine is complex and can be seen as a double-edged sword. For conditions with a strong subjective component, like pain, mild depression, fatigue, positive expectation, and a supportive clinical encounter can activate the brain's internal pharmacy, reducing symptoms without drugs that may carry side effects. However, the other edge is sharp and potentially dangerous. In trials, we must separate drug effect from placebo. If not accounted for, a useless or even harmful drug could be approved. Placebo-controlled trials are the gold standard. Relying on placebo can be harmful if it leads to foregoing proven treatments for serious infections or tumors. Delays can let disease progress, sometimes becoming harder to treat. Traditional placebo use raises ethical questions. Deception undermines informed consent and trust. Open-label placebos are promising, but deception as a tool remains a challenge. Power, undeniable. Wield it responsibly, balancing benefit against risks of misinformation and delay. In scientific research, managing placebo is essential for discovering the truth. The primary method is a control group. One group receives the drug, the control gets an identical placebo. Comparing outcomes subtracts the placebo effect from the total. To reduce bias further, use double-blind designs. Neither patients nor clinicians know who gets what. This prevents conscious and unconscious bias, leading to objective, reliable data. Use large samples and pre-register methods to add integrity. In clinics, harness positives while ensuring safety. Honesty and clear communication are paramount. Acknowledge mindset. Prioritize proven treatments first. Integrate complementary approaches only when safe and not delaying care. Monitor objectively. Blood tests, imaging, diagnostics, not just how one feels. Consider symptom fluctuations. Track longitudinally to distinguish true response from ebb and flow or placebo. Discerning a true therapeutic effect from a placebo response requires a detective's mindset and a specific toolkit of analytical strategies. One telling clue is the time pattern of response. Placebo often acts quickly and wanes as novelty wears off. Real treatments may take longer, but have sustained effects. Objective tests are crucial. Labs, imaging, vitals. If someone says a tea cured anemia but iron remains low, improvement was likely placebo, not physiological. Look for dose response. More dose, more effect, up to a point. Placebos don't reliably follow this pattern. Specific predictable side effects suggest real pharmacology. We return to where we began. Myth versus reality. The myth: placebos are inert tricks with no power. The reality: the mind can influence the body. They can trigger real chemical changes. They're not magic. They are neurobiology, powered by expectation, conditioning, and the healing ritual. Thank you for joining our deep dive at Study Freak. If this helped, please like, subscribe, share with others seeking science. Tell us in the comments, have you ever suspected you've experienced the placebo effect